Everybody, please be advised we're going to record this meeting for Anne to make beautiful notes. So anything you put in the chat will also be collected. I think, Anne, we're ready to go.
Okay, great. Good morning, everybody. I had to look and think it was afternoon. That's the kind of day it is so far. So thank you all for attending. I'm sure we'll get some people that will join kind of as we get going. As Shelley mentioned, this meeting is recorded. And we have quite a few smaller things, as far as maybe not small, they're very important, but shorter topics to get through today instead of kind of some larger topics we usually do. So hopefully there's something for everybody. Please let us know if you see a problem and you don't see a screen and we're talking about a screen or that kind of thing, because with everyone being virtual and some of us having multiple monitors, we think something's on the screen and it's not. So let's see. I mentioned who I was. I'm not going to go around and make everybody introduce themselves because it's going to take too much time with this meeting. But I do want to mention that we have some guest speakers today, which I'm super excited to hear more about myself. I think we're going to get started with an update from the Bureau in regards to EMS portal. And when we say EMS portal, people refer to it as different things. I usually call it the EMS portal. Some people call it the EMS and Trauma Bureau portal. And then some people just call it the LMS or licensing portal. It's the one that you guys sign into for your EMCTs and manage your rosters and if you have vehicles and that sort of thing. So Leah, who is gonna talk a little bit about some portal changes that are coming up so that you all are aware and can make sure that you're prepared. Leah, do you? I guess I should check to make sure Leah was.
Yeah, here. I'm here.
Great.
All right, good morning, everyone. So we actually have 3 major changes happening within the next 3 to 6 months. The first one being due to security reasons and changes from like bigger companies like Google, Microsoft email, we're no longer able to keep sending the emails using the email not reply at AZ-PIERS.com. So now you're gonna be seeing all the emails coming from EMS Trend from ADHS at Arizona.emstrendlicense.com. So make sure if you have any blockers in your system, make sure you bookmark that email. That email will be related if you're trying to create an application, if you're creating an account in the system to update the rosters. All the emails will be coming now from ACDHS at Arizona.emstrendlicense.com. The next update that item that we've been working on, and you've heard Anne a lot to, is the sync with the EMS portal and AZ-PIERS. One of the things that we're asking all the agencies is to please update the rosters. That way we can have accurate data within the LMS system and AZ-PIERS. So please update the roster. If you need help updating the roster or accessing the required role that we have in the system, please let us know and we can assist you with that. And then another big one that is coming up within the next 3 to 6 months is overall ADHS has a new logo and the state overall. So we'll be rebranding all the applications to include the new logo. All the AMCT cards will include the new logo as well. So we'll be sending out more communication on that when we make the changes, but those are the main changes that are coming up pretty soon. Any questions from anyone? So yeah, we have more information on our main ADHS website. And again, if you have any questions, just let us know.
Thank you, Lydia. Does anybody have any questions right now? We'll also have this information. I think will all be part of the minutes, so you can contact me also. Okay. I'm going to continue a little bit on that topic for item 3. I'm going to share my screen. We'll see if I can. That's okay, Shelley?
Yeah.
All right. There's my multiple tabs. Okay, so I know right now, hopefully you just see a screen. So Lydia just showed you this slide, and I just want to show it again, and then I'm going to show something else. So when we talk about syncing, and I know we've talked about this in the last couple of meetings, but I feel like visual is better. When we talk about syncing the EMS portal to AZ-PIERS, every state does it differently. A lot of states do this. They sync different types of information. For us at this time, the only thing we're looking at syncing, and the only thing I want us to kind of focus on, is we're syncing the rosters from each EMS agency, whether you are regulated or not, whether you have a CON or not. And there's limited amounts of information that will come over from the EMS portal to AZ-PIERS, but that's kind of the way that we're going to drive access to AZ-PIERS. If someone leaves your organization and you don't even know if they have access to AZ-PIERS, if you update your roster and take them off, then they will not have access to AZ-PIERS anymore. Once we do the initial sync, we're going to have to do some cleanup, which is why we're doing this kind of whole initial sync kickoff. I'll be having a spreadsheet. I'll be making sure that y'all contact me and let me know when you are ready for us to sync over your personnel, so you don't have a lot of personnel syncing over that actually haven't worked there in 6 years or something. But I just wanted to let you know that at this time we are not syncing vehicles. We are just syncing some agency information and mostly just personnel. I also, let me take this over here. This is a draft. I haven't sent it out yet. I don't expect you guys to even, I'm not going to read through the whole thing, but let me make this bigger because that's so small. Okay, is that better?
Yeah, looks great.
Okay, good, because I'm always the one that forgets that nobody can see anything on my screen but me, because it's huge on my screen. So this is something that I don't know if I'm going to email it out or if we're going to have a link or whatever. It's 2 pages, and it definitely is something that, I mean, you could print it out, but it's got hyperlinks, so it's more useful probably as an electronic document. But I wanted to go through just really quickly why we're doing this, because I realize this is asking something kind of extra. I mean, we've always wanted you to keep your rosters updated, but you know, why is this important? Why now? Well, first of all, we have a system now that talks to AZ-PIERS, so they can exchange information. Before, the system that we had a couple years ago, it did not. It was kind of it's an island on itself. There was no exchanging information between the 2 systems. So we have this capability and we wanted to leverage it for several really good reasons. One, and I think this is something that we can all remember through any emergency we've had. I mean, COVID-19 was a perfect example. You know, there was we needed to know how many EMTCTs we had. We needed to know, you know, when you look at how many people are certified in the state, well, that's great. You know, how many ever 1,000, but we don't necessarily know if they're working as EMCTs. We don't know what the surge capacity is. We don't know what EMS resources might be limited in certain areas. And that was the message we were getting from agencies. But we had no way to give that information. We had no way to show that information to leadership. So this is super important for preparedness to give an accurate picture of Arizona's EMS resources and capacity. And I'm sure all of you guys who have anything to do with hiring at your agencies would all agree. You know, I don't know if anybody has an overabundance of EMCTs. Another really, really big one is security. So this is going to be an agency-driven update to AZ-PIERS access. So you can go in, or your org coordinator, and you can have more than one org coordinator per organization, can go into that LMS portal, the EMS portal at any time, because it's web-based 24/7. And if someone leaves your organization, you can remove them from your roster. And once we get that initial sync done, that will automatically sync over to AZ-PIERS, and it won't delete them. You're not going to move them from your runs or anything, but it is going to inactivate them and not allow them, if they did have access to AZ-PIERS. And sometimes, I promise you, agencies all the time don't realize who does from the organization, because maybe they got access and someone changed roles and then someone else changed roles and someone out on medical leave. So this is a really important thing, so that you are in charge of your security for your data. You could log into AZ-PIERS and inactivate that person, but since everything syncs over from the rosters, you're going to want to do it in that roster too. So my recommendation is do it in the roster and AZ-PIERS will sync it over and either add or remove the account from your agency in AZ-PIERS. Another reason is efficiency. Just like I mentioned, you could log into 2 different systems, but why would you want to do that? So you have 1 system to update instead of 2. It gets so confusing because I know we talk about the EMS portal and AZ-PIERS, and we have Hospital Hub, and we have, and it gets to be a lot. So if you go in there and update your roster, it's a one-stop shop. And it's going to be easier too when you want to add a person. I get that request a lot, like, hey, can you add so-and-so? Your roster is already going to be in AZ-PIERS. So all I need to do is go in and add them to report instead of creating an entire account, or for you to create an entire account from scratch. And also everybody's going to be sync over as what we call a rescue service provider, and they're not going to sync over with a username and password at this time. I know it seems nice that everybody would match, but we would have overwritten everybody who already was in the system with a new username and password, which would have been really confusing. And also that means that they don't automatically have access when they sync over, even as just a provider level who could see their own information. But it means that if you want someone to have access, it's very, very easy for me or for you to go in there and just update 2 little things and they've got access, or they don't. And then lastly, one of the big advantages that we hear from the hospitals, which is one of our stakeholders we provide data to, is that when they pull up those ePCRs on Hospital Hub or Elite Bureau, where they can see those PDFs of the ePCRs that came to their hospital, right now, a lot of them only have a cert number on there. And then if they have questions or whatever, they're going to have to hunt down what cert number is that person. It will provide the, as long as you document it on the ePCR, it will provide the name of the provider, which just makes things a lot more clear, a lot easier for communication, which I know EMS agencies work very closely with their hospitals, not just their base hospitals, but ones they deliver patients to. And it just makes it more efficient and hopefully not take up as much time. So those are some of the big reasons of why we are doing this. And then what's occurring? It's a one-way sync at this time. Right now, we are not syncing back any information from AZ-PIERS to Elite. I don't think we ever will. It is a capability, but, and then I'm not going to go through all this, but I just want to let you know that this document that will probably be edited by somebody before it goes out, it's going to have the steps. So your organizational coordinator needs to log into the EMS portal and update your roster. If you don't have an organizational coordinator, because maybe you're a non-regulated agency, you don't have a CON, there's a link here, and I put it here too, so you could copy paste it out if you don't like links or your system doesn't like links where it's automatically there. And you go into this form, it is super fast to fill out. And it'll basically just ask you some very basic information if you are signing up to be an org coordinator. And then we have Donna Meyer at our organization who's going to kind of coordinate this. She'll send back some information. And then once you have this done, these are basic steps. Once you have an org coordinator set up and the org coordinator goes in there, updates the portal, you email me to let me know that it is ready to go, that we can sync it. And then I can kind of mark you off as ready to go. And after we do the initial sync, I'm going to contact your agency, your org coordinator more than likely, and just verify if we have any discrepancies anywhere so we can clean those up and then have the system. And then the big thing is continue to maintain your agency's roster. So as people come and go, please log in and change your roster, update it, so that we don't have to, it'll make it a lot easier, because otherwise we'd have to go through a whole reconciliation process again. And there will be links on here to tutorials. So if you need an org coordinator, you don't have one, that's a link to that request form. If you need instructions on how to update your roster, if you go to the Bureau of EMS and Trauma portal, I'm just going to show you guys. Hopefully you're all familiar with it. This is what it looks like. Then there are tutorials on there. One of them is how to update your provider roster. So if you're a new org coordinator or you just don't remember how, there's that tutorial. If you try to do it and you can't do it, like you don't have access to something, you can't see something, then that means there might be an issue with your permissions, and please do contact probably me at this point, or Donna Meyer if she's the one that initially emailed you. Or if you are licensed, your EMS regional coordinator, the person that comes in and inspects your ambulances, that person has access and can update your permissions. And then if you go to log into that portal and you either don't have an account or you never claimed your account when we switched over, there is on that Bureau of EMS and Trauma portal, there's some few notes on how you do that, or if you would prefer a video, there is a video. And I'm not going to go through these FAQs, but these are just some of the FAQs that we've gotten so far. So that will be available to you all. It's just not posted anywhere yet. And let's see. So does anybody have any questions on that before we move on to the, I'll stop sharing my screen, onto the next item on our agenda? Okay. So next, we have a presentation on quail kids, and we have Kim Jackson here from the Arizona Game and Fish, who's going to talk about it a little bit, and I believe Vatzel may be talking also, who does all of our data analysis pretty much and statistics. So please take it away. And thank you for coming to speak to us. Mm-hmm.
Thank you, Anne. This is Vatzel Chikani from Bureau of EMS. Shelley, I would like to present my screen if that is okay. Okay. Good morning, everyone. So today I want to talk about one of the injury prevention programs the Bureau has undertaken along with a partnership with Game and Fish Department and Arizona Center for Rural Health at University of Arizona. While doing the analysis, as you guys know that we have two in-house registry. One is our trauma registry and another is EMS registry. And what we found in our trauma registry that the trends of off-highway vehicle injuries were going up, especially it started going up during COVID, and then after COVID it stayed at a high level. And our trauma centers are basically required to carry out injury prevention efforts in their community as a part of their designation process. So we basically started working with the trauma center. We involved even Game and Fish Department, and along with the Arizona Center for Rural Health, who basically works with all the level 4 trauma centers, who helped get everybody together to figure out, okay, what can we do about off-highway vehicle injuries, which are increasing in Arizona. So before I talk about the program and what we are doing, I would like to show you some of, what did we find. So this dashboard is available on our website. It's loading.
We can't see the dashboard, Vatzel. It's still on the PowerPoint for us.
Oh, okay, hold on. I think I have to. All right, can you guys see it now?
Yep.
Okay. So what we actually queried the hospital discharge database, and we also queried trauma registry. As we know, in the trauma registry, we are talking about mainly severe injuries. So we do not capture all off-highway vehicle injuries in trauma registry. So just to get a picture, we wanted to know the magnitude of OHV injuries. We queried actually both the databases, one hospital discharge and then trauma registry. So what you are looking at right now is hospital discharge database. And see what we can see then 2018 and 2019, we are in around 4,000 OHV injuries were happening in Arizona, which increased from 4,000 to almost 4,800 in 2020 when COVID hit. And this, this is mainly like people were not going out, people were staying home, started engaging themselves into more of recreational activities. And we saw that, it's a good spike over here in 2020. And after 2020, then 2021, it continued to increase and we are at 5,000. And then it kind of slowly, it came down a little bit, but it's still significantly high than before COVID. So in 2022, we had 4,700 some injuries. I do not have at present the 2023 data available in a desktop on our dashboard, but it will be pretty soon. We are working on it to put the latest data in. So that's the total raw number what we found. And then if I'm looking at it, there led to even 22 deaths in Arizona in 2022. If I'm looking at the county level, what I can see over here is that some of my, again, our rural areas, have a higher concentration of OHV injuries compared to the urban areas. And if we see at the age and gender graph, it is slightly more among males, but it's not that different between male and female. And it is in the middle age group, right? Starts increasing up at 10 to 14 age group, and then it basically skips at that around that level to 35 to 44, and then it again starts decreasing. It amounted almost 169 million in total hospital charges, with a median hospital charge was 9,500 per patient. We also have a filter available for if we just want to see the pediatric population. And then we can see that in the pediatric population also we saw a spike, in last 4 years. Now I'm going to talk about a little bit from the trauma registry. So then we even query the trauma registry to figure out, okay, if they do that hospital discharge, let me, trauma registry, we collect some information on risk factors like alcohol, drug, helmet use, and things like that. And so we wanted to see where are we in terms of the risk factors also. So in the trauma registry also, similarly like hospital discharge, the severe injuries also increased over the years. In 2020, highest in 2020, stayed same 2021, and slight decrease in 2022. So we have around 2,000 severe injuries due to off-highway vehicle injuries. And 28% basically of those, who were involved in OHV injuries, they had head injuries. And what we saw that 66% of the people were not wearing helmet. The helmet use was only a quarter, 1/3 of the patients were wearing helmet. 44%, or 45% were admitted to the hospital, and even 10% were admitted to the ICU because of that. We found quarter of the patients, 25% had either suspected or confirmed alcohol or drug in them. And mainly it was alcohol followed by marijuana. So looking at these, when I presented this information to our trauma manager workshop, this workshop is an effort of collaboration between Bureau of EMS and University of Arizona and all the level 4, level 3, and level 1 trauma centers. We get together every quarterly, and then they talk about a lot of public health prevention efforts along with other activities they do. And so when I presented this dashboard, and last year we presented this dashboard and OHV injury magnitude, to trauma managers, the idea came out from that group is that why don't we do something at the state level? I'm going to change back my presentation again. One sec. So, so that level 4 trauma centers were very much interested in doing something in their community to prevent or increase the awareness about the OHV injuries. So the Bureau basically contacted Game and Fish Department, and we had a good partnership with them. They already had a Quail Kids program in place, which basically which educates the community members, be it a school kid or adults or any medical community. They have the programs geared towards different audience, and which increases the awareness of OHV injuries, the magnitude, and what can be done before you ride an ATV, what you should know, what you should not be doing the curriculum covers everything. And so Game and Fish Department, and I will let then Kim talk more about what this program is, but what Kim did with trauma managers is that she basically taught our trauma coordinators, this curriculum. She also, there are 2 hospitals basically have also participated in implementing this Quail Kid program in their community. And we started with like Mount Graham Regional Medical Center, implemented our pilot program first, and the program was given to 300 participants. We did the pre and post evaluation of the program too. And we learned from that pilot program that, okay, what we need to improve in the Quail Kids program. And we basically improved the evaluation survey. We worked on the curriculum a little bit more to gear towards the right audience. And then after that, we had Banner Ironwood Medical Center implemented that program in the at the middle school kids, and even the Mount Graham then again implemented in one of the middle schools in that community. I will actually, and I will let Kim talk more about the Quail Kids program in detail. But I just want to show you what the questions. We evaluated the program that she went to the school, and the trauma coordinators basically increases the knowledge of these kids about OHV and about the ATV riding. And what we actually observed, we asked them pre-test, we asked them few questions, and then again after the curriculum was implemented in the class, we asked them same questions again, and we saw this red is before implementing the curriculum to these kids, and the green is afterwards. And if you see that, we saw increase in knowledge on each and every cases. So we had a pretty good sample size, like total 278 kids between the 2 hospitals. They implemented into the middle school. 276 completed the pre-test, and 278 completed the post-test. What was remarkable is that here age warning label appropriate size, like 60%, they knew that, at what age, age warning. Okay, let me go back to, the question here. What age may not appropriate ride on or ride in an ATV or UTV unless they are wearing a properly fitted and fastened US DOT approved helmet? And answer was under 18, and only 60% knew that, but after the curriculum, 74% knew about that. About the pediatric helmet requirement during riding ATV, only 24% knew that if you are kids, then you need to wear helmet. And after the program implementations, 24 increased to 58% say that yes, we need to wear a helmet. Similarly, there is poor handling, reckless actions, and substance use. In all the questions we asked before, we saw that the participants' knowledge really increased after the curriculum was implemented. So I want to let Kim talk a little bit about the Quail Kids program and how. Now, the main reason we want to bring it up to the EMS community is that once we started this movement among the trauma centers, this idea came up is that how can we now spread this program, the awareness about this program. And another idea was that we also have the EMS folks, with the Bureau, and is working, she is our main contact with her. She knows everybody in the community. Why not we basically talk about this program and see how can we get this EMS community involved to spread the awareness about this program. And I will let now Kim talk a little bit more about her ideas and what her thoughts are on how can we work with the EMS community. Kim?
Hey guys, do you want me to present my screen now?
Yes, go ahead, Kim.
Okay. All right. Well, thank you, Vassell. That was a great introduction. I love the dashboard because now it's giving me more ideas on how we can increase our reach for the Quail Kids program. What we do right now is we have, like Vassell talked about, at Mount Graham and at for Ironwood and other places where we presented this program, we just made it to making sure that students are engaged during the course presentation. So we've tried to make this kind of a fun and interactive program. We supply, Arizona Game and Fish will supply all the materials for you to put this on. There is no out of pocket for any hospital or fire department or police department that might help us put this position or this program on. We will incur all those costs. Quail Kids program, when we taught it to Banner at Ironwood, they did a Camp Scrubs, and this was over several days. So they had the kids a little longer. So they presented a longer program to those children, and they had a longer test. They also did well on the pre-test, but really blew it out of the park on the post-test. When we went to Mount Graham, that was a shorter program. It was only 10 minutes long, which is very easy to present. It doesn't take a lot of time to do, and the kids really have a good time. You can see with what was shown to you that the pre and post tests, we did make some headway that way. I was really happy to see that they understood not riding on pavements with these machines because they seem to be something that are higher accident areas. And then what we can do for you for Quail Kids is we can do a train the trainer program for you. And I offered this to Banner Ironwood, that we will offer hands-on trainings for all of EMS that are interested in understanding about the risks and the safety limits of operating either a side-by-side or an ATV. This will be held at Arizona Game and Fish facility, which is a state-of-the-art facility where we will teach you to ride over rocks, go up hills, all kinds of, it's the fun part of Quail Kids. And then that way, when you go to teach it, you'll have a better understanding of the program. Also, we can help you if you would help, or maybe you help us, is we do marketing and we have a traditional campaign where we can do digital media or we can do social media. And if you could put some of what we have posted on your social media, that would really help us get the word out. Because sales of off-highway vehicles have been a little slack for the last year and a half. They're now starting to pick up, and there was a new report out that sales were up 40% for side-by-sides. So that's going to transfer into more visits to the ER. And the more help we can get getting the word out to have people learn about safety, the much better we will be, and then you won't see these people in your ER. Curriculum will be changing all the time for Quail Kids as the dashboard is updated, so where we can see, okay, are people getting this concept? And then two, when you give me more information about what the injuries are they mainly head injuries? Are they mainly rollovers where arms are crushed, or they're getting broken ribs. All that stuff we can make then the curriculum show that. So it's an ever-moving project to try and eliminate people coming and seeing you. That's all I have for today. So if you have questions, just let me know. Or if you want more information, I can separately send you the whole packet that we have for Quail Kids.
Would it be
Does
possible
anybody-
to have that sent out to the group? I would love that information.
Sure, yeah.
Okay.
I'll get the email list from Anne or Shelley, and I'll send it to you guys.
Fantastic. Thank you so much.
Hey, Alison, how are you doing?
I'm good. How are you, Vatso?
Thanks. I'm wondering that if this is something you guys are interested in and you think that, we can start a movement in EMS world, maybe, if that is something interested, then we can start a small work group where we can focus at the state level how we can work with game and fish department, take the experience of what already trauma centers have already done, and then start implementing at the community level with you guys.
Yes. I sign up for that. Yes.
And Kim, do you have, I know you mentioned we would send out that packet, but do you have information you could put in the chat or that we could include on who the people on the call should contact if they are potentially interested on getting more information, getting involved, finding out more about that training and that sort of thing? I mean, they can email me, but there might be a more direct contact you have, like you.
Yeah, and you know what? That's a much better idea. I'll just put my contact information in the chat, and Allison, I'll definitely send something to you right away. And then that way you can reach out to me. I don't want to flood everybody's email with something that they might already have.
Okay. Sounds great. Thank you.
Yeah.
Also, one of the things I want to also mention is that we at the state, how we help is that we have designed an evaluation program, right? We have designed a survey. So what we do is that we give out this survey whenever whoever is deciding to implement this program in their community, then we work with that entity and help them take the pre and post survey, and we collect the data, we analyze the data and show them the result of, okay, whether it was effective, not effective, what happened. So that is why if you guys are interested, maybe we can form a small work group where we can then together we collaborate, and even that will help us evaluate the program effectiveness also. So if you can then know your interest to Anne, and we have enough people, then maybe Anne can then take the call, and then we can start working together.
I think that sounds like a great idea. And I noticed on the call we have different agencies, but quite a few that service more rural areas, and not always, but I think those tend to be more the ones who are going to come across these kinds of injuries and incidents. It doesn't necessarily mean that the population resides in that area though. So certainly an education program can benefit communities even in a more urban area, because certainly people grab their ATVs and take them up north or, wherever, and go out in the desert. And I've certainly seen people injured from ATV accidents. And I think it's especially kids. I can't imagine being out in a very rural area and having a severe injury when maybe it could have been something that was mitigated. So I think this is a great program. I hope everybody considers participating. And I love the fact that there's no outlay of money as far as program materials and things like that for the EMS agencies, because everybody's watching their budgets. So that's also a great thing. Thank you, Kim, for coming to talk, and thank you, Vatso, for presenting that dashboard. Let's see. Let's go ahead, unless there's any more questions, with item 5. We have Mike and Aaron, who are from our CON rates and section, and they're going to just give a few updates about reporting requirements and that sort of thing.
Okay, thank you, Ann. Hi, everyone. I'm Mike Gracci. I'm the section chief for the CON and rates section. And just to introduce myself, I'm relatively new with the Bureau. In fact, I just had my 6-month mark, have a little bit of background in EMS. And I want to talk today, and I'll be pretty brief because I know you got a few more things to go through before your time's over. I want to talk a little bit about the new reporting requirements for what we label the annual report. Shelley, I'm going to share my screen real quick, if that's okay.
Of course.
Okay. Okay. I assume everybody can see that. Yep. Do I need to make it a little bigger or?
Yeah, if you can,
Okay.
for readability.
Yeah. Okay. So the annual report is due once a year, and it's due 180 days after the end of your fiscal year. Now, as I said, I'm new here, and I know what your group is, but I don't know exactly everyone on this phone. I don't know if I'm talking to. I'm addressing my comments to CON holders, people that this is required. So it's due 180 days after the end of your fiscal year. So right here, I've put, we've created this checklist, and this is on the EMS website under ambulance programs. In fact, it's the first bullet point. It's easy to find. But depending on when your particular CON finishes their fiscal year, 180 days later, you'll submit this report. And Ann and Lygia have made this really easy for all the users. But the annual report is actually made up of 3 reports. The first one is your compliance report, which is right here. So that's going to be your actual response times versus the response times that are on your CON. And that's one report that will be attached to the annual report. The second one is the ambulance revenue and cost report, as we call it, the ARCR, your financial information. That will also be attached. And then the third one is the AZ-PIERS report, that it's the HB 2609 summary report. So those 3 reports are attached to we refer to it as an application, and it's sent in through the portal. And let's see what else. So here we go. These are the 3 that are attached. And these new rules went into effect March 7th of this year. So we've been kind of doing, I hate to call it a trial run, but we've asked everybody to submit. We've had great response. So thank you to all you that have responded. It's a tremendous amount of data to go through, but we've got a team of people that are going through it. And we will see the next round of them coming in December 31st of this year. And I think there's, Aaron, correct me if I'm wrong, but I think there's 72 CON holders that are due in this time period here, December 31st. So we look forward, I think we've already received a few in, but we look forward to everyone submitting their report, those that are due in December. I'm gonna, if there's any AZ-PIERS questions, and there has been up to this point, there's been a lot of people, I refer them right over to Ann, and Ann has just been like a godsend, getting back to people, helping them create their AZ-PIERS report. That way they can upload it to us. But of course, you can get hold of Ann about any AZ-PIERS questions, or any other questions regarding the annual report itself, or the compliance report, or the financials, you can reach out to either myself or Karen Barnes, and we'll keep this updated, this checklist, if it will help anybody out. I'll turn the time over to Aaron if you want to add anything, Aaron.
Can I interrupt? I think we have a question from
Oh.
Vince Martinez.
Hey,
Go
Mike,
ahead,
this
Vince.
is Vince from Guardian Medical Transport. How you
Yeah.
doing?
Hey, I'm doing good, Vince. Good to hear you.
Hey, so as you know, as per required, we had to submit these same reports July 1st, and we did. And so I have to turn in my ARCR. I'm in the process of doing that right now. I just want to confirm. It'll be, of course, the new ARCR for our fiscal year of 2024. But I'm going to resubmit the same AZ-PIERS report, or the HB 2609, and the same annual CON compliance report that reflects the time period of fiscal year 2024, which is July of 23rd to June of 24. Is that correct?
I assume that your fiscal year ends on 12/31.
No, actually, it's June 30th of 24. So
Okay. Go ahead.
So, we already submitted this in July, and so I just want to make sure I've got this correct, because your department instructed me to make sure that we are submitting the HB 2609 data and the CON compliance report data that is within the time period of our ARCR fiscal year. That's the more specific question.
Okay, you are correct. You understand it correctly. That 2609 data should reflect the same time period that your ARCR is covering. Yes, you're correct.
Okay, I just want to make sure, because we can give you a more updated report, but I'm fine with resubmitting the reports that we already submitted in July. I just want to make sure that's the process. Thank you.
You got it. Oh, no problem. Thanks. Aaron, you have anything to add?
No, I just, in the chat, I put in a link to the current checklist, which we will be updating to have the information show 2024. I was also going to put in my information and Michael's information in case anyone has any questions. Feel free to reach out to us.
Good, thank you. And that's it. I whipped through it. That's everything I wanted to cover.
Okay, thank you, Mike and Aaron. And then also, Vince, if you're doing a fiscal year one, there is a newer report available that does fiscal year date range. So I can pass on more of that information if you're unable to find it in the AZ-PIERS reports list, but it's named the same thing. It just has the word fiscal year in it. Okay, let's move on to the next item. I'm going to talk a little bit about the trauma center criteria on ePCRs. So as you know, we have different groups that rely on the data that is submitted by EMS on their ePCRs to kind of complete their roles and their requirements. And one of them is our trauma centers. And so speaking with our trauma registry manager, who interacts with the trauma managers and the trauma registrars and that sort of thing, she mentioned one of the more common issues with completeness, the one that they probably mention the most, is that there is not a really good completion on the trauma triage criteria. So those are they're 4 steps, but they're 2 different data elements. And I'll pull those up in a second. But when I looked at the data in AZ-PIERS for this, I pulled 911 calls where the agency indicated there was some kind of trauma activation or alert to the hospital. So if they didn't have that, then those are also missing from this population, and completion rate probably is not going to be much better. But when I looked at ones where there was a trauma activation or alert, so EMS is saying this is a trauma, the rate of ePCRs that had neither one of the data elements filled in, so no trauma triage criteria filled in at all, is 40%. approximately. So that's a pretty large amount considering that trauma registries, they're required to get that information as far as trauma triage criteria in the pre-hospital setting from the ePCR. So if it's not there, then they end up basically having to put in not documented, and it affects their data significantly. So that was one of their biggest things. It's more of just a thing to focus on. Let me, just to make sure that we all know what I'm talking about, because check the right screen. Okay. I'll make this bigger in a second. I'm gonna go to the NEMSIS homepage. I just want to show you what I'm talking about. Go to 3.5. And I'll make this bigger in a second because I think it probably needs to be. I'm assuming it needs to be bigger, right? Yes. Yeah, looks like it's pretty small. Okay. And these are injury fields. So it's these two. Trauma triage criteria, high risk or serious injury. And it's a multi-select, so as many of these apply. I mean, they may not apply, and then you would put, you know, not applicable. But between the two of these, this is the 03, and then we talk about 04, that's the other one. Something on one of these lists should apply if you're activating for a trauma. So, I mean, we even have, let's see, where is it on here? Not alphabetical, are they? One of these has EMS judgment that it is a trauma. So maybe that's the only reason, but there should be some sort of reason documented. And I just want to point that out, that is something that has become an issue with the trauma centers, not getting that information for patients that are being taken to the hospital because they are a trauma and being activated. So that's just a little bit of request there to improve that one piece. And then let's see what's next on the agenda. Okay. Share data elements. So hopefully everybody here knows what SHARE is. It's a cardiac arrest registry. It had been housed with ADHS a very long time ago, I think before I came. And then it was housed with U of A for quite a while, and now it's back in-house, and we're still transitioning it. There's a lot to do with getting everything back on board, but it's the hospitals will participate by entering in their cardiac arrests that are out of hospital cardiac arrests that are received. And the EMS agencies, we use the ePCR data from your cardiac arrests to fill in that pre-hospital picture of what happened. And so one thing we were looking at, and let me pull up, if you're a premier EMS agency, this is also important because, I don't have that slide. There we go. Because it's going to become part of the PEEP program, this data quality. But honestly, it's really applicable to everybody because everybody really should hopefully be documenting the cardiac arrest correctly. If you are a licensed agency, it's in rule now that you report, and it specifies cardiac arrest stuff. So listen, let me know if it's, oops, it's going the other way. There you go. Is that better? Can you see that okay?
Yeah.
It looks good, thanks.
Okay, thank you. So I'm not going through the whole slide presentation, but I'm just pulling these two slides from one of our statutory meetings. If you guys were there, you probably saw it. But it's just talking about the fact that we are transitioning the database. We are looking to create those wonderful individual reports because we're still in the process of getting everything transitioned over. We happen to just coincidentally also be transitioning to a completely different data platform for the entire ADHS. So there's a lot of work involved, and Vatzel and Josie in our program are spending a lot of time immersing themselves in this and trying to get everything up online. So we do expect to be able to provide those reports to you guys, probably in a 23-24 data though together. So sometimes next year, once we get everything kind of set to go. And so it is really important we get that quality information because we can't provide information back without it. And this is super small. All right, let me see if I can. And there's other places you can find this too, but these are what are considered the cardiac arrest elements. This is the information that obviously just for cardiac arrests, we would want to make sure that it is filled out accurately and completely, which brings me to my other point. And I'll stop sharing my screen. So let's see. Oops, now that's really small. I wrote some notes for myself, so I remember to go through it. So obviously, when we're looking at pulling data to give to the share registry or to provide reports on cardiac arrest. Oh, sorry.
I don't think, are you displaying something?
No, I'm not.
Okay. I'll go back to the agenda. Sorry.
No, that's okay. We need to be able to find the cardiac arrest. Sounds stupid and simple, but it's a lot harder than you would think sometimes. We have a great data element. It's e-arrest 01. Is this a cardiac arrest? Basically, it's yes, no. It's no, which is not. It's yes prior. Hold on. It's yes prior to EMS arrival or yes after EMS arrival. And that's primarily how we would generally determine if it's a cardiac arrest. And then from there, we have certain other filters we look at to see if it's appropriate for share, since it's not like a DOA or things like that. And we looked at it from a lot of different directions. So trying to find out how many ePCRs approximately were cardiac arrests, but were not properly documented as a cardiac arrest, yes. Which is kind of our filter question. It's a little hard, but one of the things Vatsil and Josie looked at was whether or not there's another indicator in there that it is a cardiac arrest. So sometimes there'll be type of CPR done. Sometimes there will be, if it's a cardiac alert, once again, an activation where you're alerting the hospital that it's a cardiac event that's coming to their hospital, those kind of things. And looking to see if we can find these ones that normally we would miss. So I think everyone agrees cardiac arrest, very big deal, very, topic that we all want to know more about and how we can assist. And I think we have about a 10%, as far as we can determine in AZ-PIERS, rate of ePCRs where it says it's not a cardiac arrest, but it in fact is a cardiac arrest. We did this also by some of these, honestly, looking at the narratives, skimming some narratives, doing some searches, keyword searches, just to try to see if we could figure out, was it the other data that was wrong and it's not truly cardiac arrest? And most of them were cardiac arrests that were just documented as no. You'll see the item on the agenda says even when you have ROS. So there was some anecdotal evidence that we were told that sometimes agencies, for efficiency purposes or whatever, will start pre-documenting their run before they get to the scene, and they'll put in no, not cardiac arrest, and no injury or whatever. I don't know why, but just I guess to get it set that way. And they're not going back later and changing it to yes, even though they're documenting other things. And this is really problematic, obviously, because we're missing these 10%. And that's a lot of information on cardiac arrest, especially if they end up being viable ones that go to the hospital that we're not able to get. So another area of focus we really, really want to emphasize during this meeting is if you have a process where you think people are putting in no, or also we were told that what happens is sometimes when a crew, and I found this unbelievable, but this is what we were told, that sometimes it happens where if a crew gets ROSC, they now decide it's not a cardiac arrest and they will change it to no. I'm not totally sure if that's going on, but that was just another example why we felt like we wanted to highlight this, is even if you get ROSC, it was still a cardiac arrest because you went through all that work to get them out of cardiac arrest, and that's kind of information that we need. So anyway, I realize it's probably stating the obvious to most of you guys, but I really, really wanted to emphasize that because that's going to be a key thing that we start looking at, and we don't want to miss those 10% of cases because you will not get information back on them then either. And we want to make sure we give you credit for your resuscitations and other things in your efforts. Okay. Does anybody have any questions on either of those before we move on?
I just want to acknowledge that we're coming up on time.
Yeah.
We can go over, but I just,
All right, I'm gonna skip the difference between a schematron and a validation rule since that's a longer one. The next two are just kind of announcements, I guess. So documenting incident location for naloxone administration. This is, once again, it's more of a data quality thing. We really want to emphasize the importance. We haven't really seen any issues necessarily, but the importance of picking the correct incident location. So for example, we have, community groups, injury prevention at ADHS, they really want to make an impact in your community. They want to provide, injury prevention information or kits or whatever. But to do that, a lot of times they need that injury location. So for example, we were approached by a group within our agency that is looking at providing naloxone to be available at schools, like to the nurse and such, in case there's overdoses. Well, we're going to look for evidence that that's necessary. And one way we're going to do that is we're going to look to see how many suspected opiate overdoses and naloxone administrations by EMS or law enforcement we had at a school location. You could pick high school, middle school, and elementary school, unspecified school. And without that information, we really don't know. Yet we know we have someone maybe under 18 that had a opiate overdose on a Monday, but we don't know if that was at a school. And that's super, super important information that will directly impact having that availability. Also, asthma and difficulty breathing. That's another topic that people are really looking at in schools. You guys know about the heat injury stuff. Where someone falls, that's also something that's coming up. So there's that sort of thing. It's really, really important to make sure that you can get as specific as possible. Drowning was one of those weird ones where sometimes people will put, it's a single level home, which is true, but if they drown in the swimming pool versus the bathtub, that's a different kind of thing. And single level home would make sense for, maybe drowning in the bathtub, and there's another area you can fill in. But private swimming pool is really what we're looking for, to see. And then if there's an apartment complex swimming pool, there is apartment complex, but once again, is it in their apartment, or is it, is it a child and it's in the bathtub? Is it at apartment complex swimming pool? We have those kind of differences. So if you're able to, we all know that drowning prevention is a big thing. And sorry if you hear noise in the background, because my kids are off of school today, and my daughter let the dogs into my office, and now they want me to let them out. So I'm just going to go. And then I think that is pretty much it. I don't want to run over, so we'll probably save the next two topics for next time. Just to give you a heads up, though, the discussion about lift assist documentation, falls, same level falls especially, are a huge issue, and it's something that's not necessarily well captured in our trauma registry unless there's certain kinds of injuries associated with it. So there's been some discussion of, if we looked at lift assists, which is a lot of times people who have fallen but don't have an injury, you go out there, right, you lift them back into bed, you get them off the floor, you maybe evaluate them, but they seem fine. Do we see a fair amount of those before we see a serious fall injury, especially to an elderly adult? I know my personal experience, yes, but we need to be able to find that information. And this is not something that's a documentation issue so much as I'm trying to figure out how we can pull this out, and I need your guys' help, because I don't see an easy way to figure out if it's a lift assist versus just a call and somebody didn't need any particular medical care. So that's what we'll talk about next time. All right. Currently, we have our next meeting scheduled for a month from now because we had to reschedule this one. I may be moving it into early December, just so we have a little bit time apart, but I will probably send out something and asking you guys if you prefer that, because then December gets into, a lot of people being off for the holidays too. Maybe we'll just have like a mini meeting where we can cover these other ideas. All right. Does anybody have anything else before we get off? I appreciate everybody who came to the meeting. Please spread the word, because I think we only have about 25 agencies on, and we have like 180 agencies reporting. So there's probably a lot of agencies out there that are not on these meetings and are not getting this information, which means usually a lot of individual follow-up, or people are pretty frustrated because they didn't know that they need to be doing something. So I'd love if you guys could encourage attendance. We try to keep them shorter. Now it's an hour instead of 2. And there's always a virtual option. So hopefully we can get more participation in these. All right. Thank you so much, everyone, for being here. I really appreciate your time. Please reach out if you need anything. And I hope you have a wonderful Thursday.
Thank you, everybody.